Hi, thank you. This is the second of my COVID-19 vodcasts, and I really just want to reiterate what I said last time about what a fantastic job that you're all doing. So thank you. What unprecedented, challenging times. Somebody's actually mentioned on a call to me today, this is one of the biggest things that the country's faced since World War II. Well, I suppose that puts it into a bit of perspective, doesn't it, really? But I think for us as an organisation, the two important things are keeping patients safe and looking after patients, but also supporting staff. And that's what we've been really hard and doing really hard to try and support staff, both those that are working from home as well as those actually in the front line, from our bases in Whitby all the way through down into the sites at HQ. So obviously working from home is government advice, and please let's do follow government advice wherever we can. That is the real way to slow down the pandemic that we're in at the moment, and you see the figures on a day-to-day basis. What was really interesting is I think it's really bringing the NHS into the spotlight, even more so, but for the positive reasons, which is really good, because as you know, I've always been and still am absolutely proud to work in the NHS, and none more so the other night when everybody was clapping on the street. She brought a tear to my eye, and I think that's really good. I think we just need to really say how fantastic it is and what a fantastic job you're all doing. I find it really difficult to visit everybody. We've got 82 bases, so what we are doing is I'm Skyping or speaking to people on the phone. So even though you might not see me face to face, because again it's such a big patch, I am going to dial into Skype meetings or to just have a general talk to you on the phone. So if we've not got those booked in, please wait, that will be happening, or contact Jenny and we'll do that. We have been doing and we will continue to do the Ask the Exec sessions. So obviously we'll find out how that went when we get the feedback from people about how the first session went, but that's our choice, that's your time to work and listen to the execs and to have that two-way conversation. So what have we been doing? There's a lot of national and regional work that's been ongoing, and I've been heavily involved in not just the regional work but the national work. But I think locally as a trust we're really in a good position. We've really come out of the stocks really quickly, we've prepared well, and I think everybody that's been involved in that. To change bases and to move patients and staff has been phenomenal. Just working from home is a complete different concept to people. So I thank every single one of you that's been involved in that, because what a great team effort. We are a community, and I think it's really showing now, and certainly as I say, we're really ahead of the game, so we've really prepared ourselves for the surge that's about to come, unfortunately, and that will probably happen in the next couple of weeks. But what's also important is looking after you and the well-being of staff. So please keep telling us what we can do more of. We're delivering food parcels and recharge parcels. We're going to have some little prezzies with bath bombs in and hand creams, etc. We're trying to sort out transport. So if you're struggling with transport, then let us know. We've got volunteers. We said that we'll pay the bridge toll. We're looking at fuel vouchers for people, and I'm actually in conversations with the bus companies at the moment to see if we can get free bus fares for people. There's lots of things that have come out nationally for NHS staff around mind apps, Headspace, etc. So have a look at those as well. But as an organisation, we're doing a lot to support you. We've also got a lot of new staff as well, so please we'll need to support them. Some of them are retirees and returns, some of those are just wanting to help out the NHS, so please, as I say, do support them. We're doing a big recruitment drive in Whitby because we're opening another ward at Whitby, so again, my heartfelt plea to anybody that knows, maybe people that work in Whitby who haven't worked for a while, who want to come and work for us, then please let's galvanise that if we can. We're bringing in students. We've got a lot of medical students with us as well as people from all different corporate sectors as well. So I think that's really positive and really good for us to get that real rich mix of staff. But thank you all, because as I say, moving bases, dealing with difficult circumstances is really tough on people, as well as the challenging messages that you're getting from the media. We will put out what we think and what we know are the right messages, so please have a look at those comms. I know sometimes it's really difficult because there's a lot on, but there is a frequently asked questions section that we'll keep updating, but do have a look at those comms that come out twice a day and over the weekends now, because we're all working across a 7-day period. We're in it for you. Do let me know about things. I mean, the two things that I suppose that we've been worked really hard on are PPE. personal protective equipment, and we have got reasonable supplies of them. It is a just-in-time model from a national perspective, but we have got a reasonable amount in our storerooms for that, so they will be filtered out to the right areas, and we're actually a bit ahead of the game with our PPE guidance, so again, check in on that. And the other is staff testing. And we are pushing really hard, certainly for mental health community staff, to be tested as well. So again, watch your space on that, because I am doing a lot of work nationally about trying to push that across the patch. So please keep going. You're doing a fantastic job. You are changing people's lives. You are making a difference. Let's be really think about ourselves and really care for each other at this difficult time. Keep your comments coming in relationship to how we can help you, but please stay safe out there, and thank you. You are absolutely amazing.